You're listening to Tech Talk Central.
This is Vicki Kolovou for Tech Talk Central, and I'll be interviewing Dr. George Dafoulas, internal medicine resident here at the University of Athens. He's going to talk about an interesting topic that actually is, from what he told me, we've tackled first time here in Greece. It has to do with epidemiology and using big data analytics of e-prescription systems to learn more, obviously, from that. But before first of all, welcome.
Thank you for the invitation.
So we must understand that Greece is quite forward when it comes to the e-prescription system. I've been hearing that all day.
Yes,
Can you just to open that, can you say what Greece gave you, what the system gave you, and why we are there?
It's a classical example of leapfrogging when you don't have a lot of infrastructure in e-health like we did in Greece in the past. When you are entering the new era, you get the best and the new technology which other countries have already worked before. So we learn from their mistakes and we don't do the same mistakes. So we leapfrogged. And so we established a very advanced e-prescription system in Greece.
So it is advanced. I've been hearing that, but
it's
just, hearsay. I don't really know why everybody's admiring us so much. So I got what you meant. So tell us what you did with that.
Well, the e-prescription system in Greece was established a couple of years ago in order to save money from medication expenses. So it was a classical example of that crisis could create opportunities and interventions, new system introduction in a system, in a health system, in the health sector. So because of that, they established the e-prescription in a hurry using the available modern technology. So they achieved to reduce costs for medication, but at the same time, nobody paid attention that the other uses that this system could provide. So identifying in the literature some other countries, there are not many, that had used that e-prescription system in such a wide field, a wide sector. We learned that other countries had performed smaller studies using e-prescription data for epidemiology purposes. And we had the advantage in Greece that almost all the population is included, so we could perform a fantastic epidemiology study.
First of all, we are a 10 million population, around 10, 11, so it's not very wide, but it's a good number.
Yes, it's about 90-80%. So it's almost everybody is there.
Okay, so which diseases did you decide to tackle?
Well, this database, we selected diabetes and rheumatology diseases, and the reason for this is because this database is not made for research, so it has many limitations you should consider in order to produce objective data. So we selected the diseases that the diagnosis is clear with a lab test, and you couldn't have a misunderstanding in the diagnostic criteria.
False data.
Yeah. And that's why we wanted to have this mechanism to deal better with, to have a better management of the data. And so we used that we used the database to try to find out the epidemiology of these diseases, and also made some correlations with AIDS or other comorbidities. We are still working on them, of course, but we were able to announce that in the scientific conferences this summer. And yesterday we made that announcement to this conference. And many other countries at the conference approached us and invited us to show them the methodology used. We are going to publish it also in a journal. So it's a very pioneer study. And
this is an ongoing project?
Yes,
I'm sorry?
yes, of course.
Can you tell us how long? It's a EU project funded?
No, it costed nothing to the government. That's another advantage of a big data analytics, that nobody paid us to do that. We did it with the research grant from the university, which was only to keep busy and to pay the two researchers that deal with the data, because all this data came from crowdsourcing, if I call it, of everyday clinical practice in Greece the past year. So there was a crowdsourcing way of funding it without cost for the system.
So do the doctors, the medical staff know it here or not yet? Have you announced it to the medical?
We have announced it in international conferences this summer, and we plan to announce it in the respective conferences on national level in the coming months. Yeah, so it's one of the. It's a very new project.
Yes.
Yeah.
Any special observations that are? Well, you're not a doctor in that sense,
Yeah.
medical doctor, but any spectacular observation you can talk about? Anything that surprised the results?
Not really, but that was where
You were making the methodology.
We will be afraid to have spectacular information to tell
Obviously,
you the truth.
yes.
Because if we had found numbers that don't match with classical research outcomes, we'll be afraid that probably we have done a mistake.
False, yeah.
But we provide an alternative methodology, which is very powerful and very effective.
So, in what diseases can the methodology be? In which cases will it be able to be used by other countries, for example? Or
Yes. Diseases where you don't have many opportunities to introduce a bias into your methodology, where everything is
There's
clear.
plenty of them.
Yes, they are. So we're looking forward to the next steps in the coming months.
So, in the bottom line, you created some kind of algorithm that takes in the data, calculates, and raises red flags.
And of course, and also, of course, and the clearing data methodology. So for the next steps where we want to go more in depth in the data, we will use technical expertise in data cleaning and data mining, because now we worked only with the first level of data, which are the more clear one. But of course, more analytics require more sophisticated methodology. Yeah.
Well, all algorithms are always improved as time goes on.
Of course.
So, against how many other scientists do you have to compete in Europe, for example? How many others have done this?
Not many. There is only one journal on big data with only 1 year in press. So it's a very new field, and only a few teams have worked and published results, and only mostly on a regional level. So we are a very small community at the moment, because not many countries has this powerful data set.
So, apart from the data set, who did the data analytics? Because, your field is a little bit different, and I've always been saying we have a lack of data analysts. So whom did you use?
The university.
So the university provided data analysts?
But most of them work for either for private sector, non-medical projects, or EU-funded projects. So that's the expertise was going most of the time abroad, working for people abroad, subcontracting for people abroad. But now we have data sets in Greece that could provide new opportunities for experienced personnel here in Greece to do that research here in Greece and for Greece. So
was there a learning curve? Because I can't imagine if somebody's analyzing data for oil, gas consumption or electricity consumption, it's not easy to just jump over to health. So there must have been a few falses, a few mistakes back and forth there. Is that right?
Yes. Well, these teams were experienced with previous projects, so we took advantage of their experience. Yeah.
And you're learning. Great. So this sounds really interesting, and I wish you all the best, obviously. What else are you doing? I know you're doing a lot of interesting things. Just to close this interview, tell me about the other things you're also doing. You're involved. In the past, it was e-curricula.
Yeah, it was. I'm still involved part-time with telehealth projects there. This is how I started. But of course, telehealth is becoming more everyday technology now, and research you have to move on to other topics which are still pioneer sectors. So
what are you going to move on to? After this, no. What are you? What are you dreaming of moving on to?
Research is my favorite. What I would like to. Big data is a topic in ICT, and diabetes is the clinical sector I'm interested in the future.
So you see yourself
more classical.
There. So you see yourself there in the next years.
So
it needs a lot of work, obviously.
Yes, of course.
So thank you for being with us.
Thank you for having me here.
It was Dr. George Dafoulas, internal medicine resident at the University of Athens, talking about big data and epidemiology. That's learning from data. What's different, what starts epidemics probably. So this was Vicki Kolovou for Tech Talk Center from the eHealth Forum. Thank you for listening. Bye.